My name is Tess Garland, and I will be demonstrating how to complete a head-to-toe assessment on a consenting adult. Let me have you state your name and date of birth, please.
Nick Canty, 2497.
Nick, are you able to tell me what month it is?
December.
And what year?
2015.
And do you know who our current president is?
Barack Obama.
Okay, Nick. So I'm just going to start by taking a look at your skin here. I'm just assessing for the integrity of your skin. I'll check your cap refill. Also check your radial pulse. You could also complete a full set of vitals at this time. Okay. And we'll start with the head. So I'm just inspecting the head for any lumps or bumps. Making sure that it's symmetric. We'll take a look at the scalp. We'll start with your eyes here, okay? So I'll have you take this card and place that in front of your left eye. And I'll just have you tell me when you can see my fingers come into your visual field.
One.
Good. We'll switch to the other side. And again.
One.
Good.
One.
Good. And I'll assess your conjunctiva and your sclera, so I'll have you open your eyes for me. Go ahead and look up. Good. And the same, go ahead and look down. Perfect. Okay, Nick. Just look straight ahead for me, please. I'm assessing to see this reflex in both of your eyes. And I'll have you follow this pen with your eyes only. Perfect. Okay, Nick, can you close your eyes for me? And when I tell you to open them, you'll see a light pass through. I'm checking for your dilation and constriction. Go ahead and open. Perfect. And open. Perfect. Okay, and Nick, can you focus on something there in the path, in the distance? And go ahead and switch your gaze to in front, the pen here in front of us. Perfect. And go ahead and do that again. You look in the distance. They dilate and they constrict. Okay. Nick, I'm just going to palpate your sinuses here. You tell me if you have any pain or tenderness.
No.
Okay.
No.
Good. Okay. And we'll check your ears here. So I'm just checking. Again, no lesions, bumps, lumps, bilaterally symmetrical. No pain or tenderness when I pull there?
No.
Okay, Nick, we're going to do the whisper test, so I'll have you take your left hand and just go ahead and plug your ear there slightly. I'm going to whisper 3 words. You repeat those to me.
Ball. Blue. Cap.
Perfect. Switch to the other.
Ball. Blue. Cap.
Perfect. Nick, we'll take a look at your nose. And check to see the patency of your nostrils. So I'm just going to go ahead and close one. You'll breathe in. Good. Nick's got some excess fluid there. Maybe a little bit of a sinus infection working. I'll have you look up. I'm just going to take a look in the nose. Good. Perfect. Okay, Nick, we're going to take a look in your mouth. You have to open and close your mouth for me. Okay. And can you clench your teeth together? Perfect. Just go ahead and put my gloves on. mouth again for me. Go ahead and put your tongue back in there. Good, perfect. Checking his teeth and his gums. No lesions, no sores. Go ahead and close your mouth and just show me your teeth. Perfect. Checking the lips. Okay, Nick, and go ahead and open your mouth and say ah.
Ah.
Good. You see the uvula rise and fall there. Nick, I'm going to check your gag reflex.
All right.
Have you go ahead and open your mouth for me. Perfect. Okay. And I'm just going to feel around in here, just a little bit, palpate the inside of the cheek. Perfect. Okay. And as I have you sitting here looking at me, Nick, I'm going to have you close your eyes tightly and go ahead and force them open. Can you smile for me? Can you frown? Can you raise your eyebrows? And can you puff your cheeks out? Perfect. I'm going to check for TMJ, so I'm just going to palpate this bone here. I'm going to have you open your mouth for me. Good. And one more time. No pain, tenderness when you do that. Okay, we're going to check your lymph nodes. Tell me if anything is sore as I palpate.
No. 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 No.
Check your deep cervical here. See if you can do your gown a little bit. I'm going to have you shrug your shoulders for me. Just lift them up like this. Perfect. Okay. We're going to check the range of motion in your neck. Okay, so I'm going to have you just take a look to the right and come back to center, to left, and center, up, and center, and chin to chest. Perfect. And shrug your shoulders up. Good. I'm going to do the same thing against my resistance on my hand, so I'll have you go ahead and turn your head to the right there. Good. Left. Good. Go ahead and shrug your shoulders. Perfect. I'm going to palpate your thyroid. Okay. And I can also test Nick's thyroid with the swallow test. So I'm just going to move behind him. You can shoot from the front here. I'll have him drink, just take a sip of water. What I'm going to have you do is you're going to tilt your head to the right and tip it down forward just a little bit. And go ahead and take a swallow. And Nick's thyroid slides up like it's supposed to. Perfect. Okay. All right, Nick, I'm going to take a look at your back here. So I'm just going to slide down the gown. Okay. I'm just looking for symmetry. I'm going to check your expansion here, so I'll have you take a nice deep breath in and exhale. Perfect. And Nick, I'm going to have you say 99.
99.
99.
99.
99.
99.
Good. I'll go ahead and palpate Nick's spine. Good. And if you tell me this is tender at all?
No. No.
Good. And now we're going to percuss his lung fields. Now I'll take a listen to your lungs next, so I'm just going to have you sit forward slightly for me. Okay, you're going to take nice deep breaths in and out of your mouth. Go ahead and take a nice deep breath in. Good. deep breath here. And one more. Perfect. Okay, Nick. Come around to the front of you now. And we're just going to take a look at your chest. Just watching for general respiration, use of accessory muscles, and his general symmetry. Nick, I'm going to have you say 99.
99.
99.
99.
99.
99.
I'm going to take a listen to your lungs in the front here. Going to take a nice deep breath in. Good. I'm just going to palpate here and make sure there's no nodules, nothing tender.
No.
Okay. All right, Nick. So now I'm going to have you lay down for me. Just going to increase the head of the bed slightly. I'll go ahead and get the sheet on. What I'll have you do is we'll bring down the gown here. And I'm checking Nick's chest here. I'm going to palpate for the PMI. This time also I can palpate for his carotid, which is one at a time. And now I'll auscultate using the bell for any roots of the carotid. And I'll listen to Nick's heart sounds now. For his apical, listen for a full minute.